Okay, we're going to go ahead and get things started. So I want to thank Dr. Ovadia for joining us today. Tyson Reed at 25's connected me with him, and we are big on the subject right now, and uh, of heart attacks and preventing heart issues. And Tyson had reached out to me to uh, vet and meet Dr. Ovadia for more information. And so I'm going to let him go ahead and take this on, and there will be a Q&A at the end. So you're welcome to comment in your questions and I can ask them for you later. So thank you, Dr. Ovadia. It's all yours.
Thank you, Jessica. Great to be here with all of you. Really excited for this innovative partnership that we're hoping to build with your department. On a personal level, I'll just start by saying, how much I value the work of all the first responders out there, and I know how difficult a job you guys have. Before going to college and med school, and during college, I worked EMS for many years, and then of course, lots of time in the trauma bays. Having guys and girls like yourselves delivering patients, and I know all that goes into it. The stressful life, the odd hours, and I have come to realize through my own personal journey, my professional journey, how we can neglect our health, those of us that are in this. And for those of you that don't know my background, I was a morbidly obese pre-diabetic heart surgeon. I was a very unhealthy heart surgeon. And, I came to the realization that I was going to end up on my own operating table, so to speak. And I was at a loss because, I had been educated to teach people to do all the things that many of you have probably heard, eat less, move more, eat a low-fat diet, count your calories, follow the food pyramid. And it wasn't working for me, and more, it wasn't working for my patients. And, thankfully, I started to come across different information. I started to ask different questions. And ultimately, I was able to fix my health and overcome my health challenges with a focus on metabolic health, which we'll talk about what that is. And I came to realize how, for the majority of my patients that had heart disease, this was, the true root cause. And then I came to realize that for the majority of sick people out there, whether it's diabetes, obesity, high blood pressure, heart disease, Alzheimer's disease, many forms of cancer, all of these things that we end up suffering from, metabolic health is the common link, is the common root cause. So me and my team are now passionate about educating people about metabolic health, helping people to understand, empowering people to take back control of their health. And when Tyson reached out to me a few months ago and explained, I know you within the department, you've had, guys that have had heart attacks. Like I said, I know what goes into living the life that you all live and how that can work against your metabolic health. And so, I immediately said, yes, what can I do? Let's build a program to, help the department members take control of their health, take charge of their health, make sure they're optimizing their health. And so this is going to be the first kind of session of that. This is sort of an intro session. The vision is that, Jessica and I will kind of have a little discussion for about 20, 30 minutes and then leave, another 20 or 30 minutes for Q&A. And then we really want to hear your input as to how we can serve you. My team and I and Brian and Renee from my team are on the call. We have some ideas, but ultimately we want to hear from you how we can best serve you and how we can partner with Portland fire department to really do some innovative stuff. We want Portland to be the model for fire departments across the country as to how you can value and prioritize the health of the members. So with that, Jessica, I guess, let me know what you'd like me to talk a little bit about. And then, like I said, let's open it up to questions.
So let's start with coronary artery calcium screening. If you could talk a little bit about that and the benefit of doing so, because our members are very interested in that right now.
Yeah. So, I think coronary artery calcium screening is a essential test that I really recommend for just about everyone. What age maybe is the right time to do it is going to vary. So let's start with the basics. Coronary artery calcium scanning is a type of CAT scan that can be done. Many of you, I'm sure, are familiar with CAT scans, non-invasive, lay down on the table, kind of go in the scanner. The test takes literally 5 minutes. They don't have to put an IV in you. And what it is going to show us is whether or not you have calcified plaque in the arteries of your heart. And this is usually one of the earliest signs of the development of, heart disease, what we call atherosclerosis, the buildup of plaque in your arteries that, over time can lead to you having a heart attack. And one way to think about this is, an analogy to, let's say, breast cancer, where, you can wait till you have, a mass in your breast that you can feel, you're having symptoms. But by then, the disease is oftentimes at advanced stages. So instead, we encourage women to get mammograms so we can find the earliest evidence of breast cancer and we can intervene at that point. And the same should go for heart disease, but it doesn't. For 50% of people who have heart disease, their first indicator that they have heart disease is when they have a heart attack. For 1/3 of people who have a heart attack, it's going to be a fatal heart attack. First time, no chance to save them. So waiting for the heart attack is a bad strategy. And this is why I emphasize, coronary artery calcium scanning, because it is the mammogram for the heart for atherosclerosis. It can show us early that you're developing plaque, that you're on your road to heart disease, clinically significant heart disease. And by doing so, again, we can intervene. There are things you can do. This information is empowering. I know, sometimes people get scared by doing these types of tests because they sort of don't want to know what's going on. But I encourage everyone to think of this as power, as information that we can then act upon, because even if you have some plaque in your arteries, there are things we can do to stop it, to slow down the progression, even to reverse it. And, that's what we work with a lot of patients on in my medical practice. So coronary artery calcium scan, very important test to get, typically pretty inexpensive. $100 is probably the average. Sometimes I see it even cheaper than that. And like I said, non-invasive, literally takes 5 minutes. Don't even have to put an IV in you, and it's going to give you the information that you need to act upon, and then take a proactive approach. So you make sure that you're not, one of the many people that the first warning is when you drop dead from a heart attack.
One sec. There we go. Thank you. A follow-up question about CAC test results in general. What score do you recommend prescribing, like for a statin, and understanding the things that will vary, like with gender, age, etc.?
Yeah, so if you end up having plaque in your arteries, I believe that you need to take an aggressive approach to making sure that plaque doesn't worsen over time. Cholesterol is part of that picture, but I don't think it's the full picture. And there's a lot of detail, that we're not going to get into during this call, but as this program unrolls, hopefully these are things that we will cover, and these are things that I, work with people on in my practice and in our coaching programs. You need to manage all of the risk factors that contribute to heart disease, but you need to understand that the most important risk factor, the true root cause of heart disease, is what I call metabolic health. The more technical term for it is going to be insulin resistance, and understanding what that is, how you test for it, how you know if you are insulin resistant, if you're in poor metabolic health, and then how to reverse it is going to be the most powerful strategy we have to then stop that progression of heart disease. In terms of the age, and I meant to talk about this before, but got a little off track. So what age should you have a coronary artery calcium scan at? I think for most men, the answer is probably 40-ish. For most women, the answer is probably 50-ish. If you have a strong family history, if you are not in good metabolic health, if you have reason to be concerned, get the scan earlier. There's no harm in getting the scan earlier. You just need to understand that having a 0 score at 20 or 30 years old is not as meaningful as having a 0 score at 60 or 70. Now, to the contrary, if you get a scan early, let's say you're a 30-year-old male and you get a scan at 30 years old, and your score is anything but 0, that's a major red flag, because that means you've already started that progression. And if we don't do something to slow it down and reverse it, by the time you're 50 or 60, you're now going to have a lot of coronary calcium and a lot of disease. The score cutoff, as to how aggressive you need to be on investigating it further, again, going to depend on your age, going to depend on your situation. But generally, when these scores start to get above about 400 is when there's a possibility that you might have clinically significant disease, meaning, maybe you're going to need a stent, maybe you're going to need bypass surgery, or, you're just well on your way to the heart disease risk, to, having a heart attack, and there might be more advanced testing that we need to do. But like I said, even low scores under 100, that should be the warning sign that your body is starting this process, starting to form plaque, and we need to be aggressive about, changing that pathway that you're on.
Thank you. I'm going to turn it over to Tyson Reed now for another question.
Yeah. Hi, Dr. Ovadia. How you doing?
Doing great, Tyson. Good to see you again.
Yeah. Hey, I just want to clarify, just while we're on the topic of coronary calcium scanning. I know, because I've spoke with some members in the past who are over the age of 40, and the doctor would not prescribe or order the test for them because they had an LDL that was in acceptable range. I guess how would a patient, or how do you look at or value LDL versus maybe more valuable markers in terms of heart disease? And what's the best way for somebody to advocate for themselves if they have a physician that's maybe unwilling to prescribe that based on that one factor?
Yeah, so the high level on LDL is it's a lousy marker of heart disease risk. Unfortunately, it's what most doctors focus on. And again, there's a lot of nuance. And my high level message about cholesterol is it's the quality of your cholesterol, not the quantity, that matters. And LDL only looks at the quantity. But there are lots of I think just having a conversation with your doctor about I have a high risk job. I'm very, under stress a lot. Asking them, to test you for insulin resistance. And unfortunately, they may or may not know what that is. Maybe you might have to go to a different doctor. But really, the truth is, I can't really fathom why any doctor wouldn't want to order a coronary artery calcium scan. Be clear with them. Say, I know I'm going to have to pay out of pocket for this because most of the time insurance doesn't cover it. I know one of the things we've been talking about is trying to figure out maybe if there's some way that the department can start to do that, or we can make arrangements. But start with I've been learning about metabolic health. I've been learning about insulin resistance. I want to understand if I'm insulin resistant, what testing can we do? And then just, I know I have to pay out of pocket for this coronary artery calcium scan. I'm willing to invest in my health. And understand that, because your insurance company doesn't cover it, doesn't mean that it's not useful. Your insurance company has a whole different set of things that they're considering as to what they'll pay for and not pay for. But that doesn't mean it's not a useful test. And, you can challenge your doctor a little bit on that. And ultimately, if they're not willing to work with you on this, maybe it's time to shop for a different doctor. All too often, we don't sort of put the effort into finding a doctor that we should. For too many of us, the way that we found our doctor is the insurance company assigned them to us, or we went through the insurance company directory. We saw who was the closest, family doctor, and that's who our doctor became. And sometimes that's not good enough, like you're anything else, you're looking for a mechanic, you're looking for an accountant, someone to do your taxes. The easiest answer may not be the best answer for you. So, be active about finding a doctor to work with on this stuff. And then, a lot of times, this is something to know as well, you can call around to imaging centers. You can say, do you do coronary artery calcium scanning? Almost any imaging center, any place that does CAT scanning these days will likely do the test. How much does it cost? And, they'll tell you, and they'll say $99. You'll say, great. Do you have a doctor? Do I need a doctor's order? Because many of these imaging centers will have a doctor on staff that basically orders the test for you. So you may not even need your doctor's order. And then, like I said, as we roll out this program to the department, we may have some other options for that. I may be able to order testing for the members. We're kind of working out those details. But understand that these days, you don't have to work with just the doctor that's down the street from you. Telemedicine's a very viable option. So start searching around, find a doctor to work with that if your doctor isn't able to partner with you on this journey.
Thank you.
Okay, thank you.
Go ahead, Tyson.
Yeah, so thanks. I just wanted to ask that while we were talking CAC tests. So going back a little bit, can you just give to everybody who's not familiar with it, like a broad view of what is insulin resistance, what causes it? Is it a dietary thing? How we avoid it? And if it's the first step to pre-diabetes or diabetes, and how that can progress, just maybe a brief, so people have a limited understanding of it.
Yeah, great question. So, insulin, many people are familiar with insulin in the context of diabetes, and understand that insulin is one of the sort of master hormones in our body. And it does a lot of things, but its primary role is to basically help our body to properly partition the energy that's coming in. And the energy that's coming in is the food that we're eating. Glucose, sugar, in the bloodstream is toxic. above, certain levels. And so one of the priorities of our bodies and of insulin is to get sugar out of our bloodstream. And that's one of the high level things that insulin does. It signals your liver, your muscle cells, and then your fat cells to take up sugar, take it out of the bloodstream. And those are the three places basically that we can put, sugar. We can put it in our liver, we can put it in our muscles, and then we can put it in our fat cells if we're not able to immediately burn it off for energy. So when those storage areas start to get full and your blood sugar level is going up, and therefore your insulin level is going up, the cells become less responsive to the insulin. So this is what insulin resistance is. For that, kind of same level of insulin, you're not going to be able to get as much sugar out of the bloodstream. And so the body's first response to that is to make more insulin and kind of keep trying to overcome that signal and shove it in. Eventually, you reach a point where the amount of insulin that you produce can't keep up with the amount of sugar that's in your bloodstream. This is when you get diabetes. This is when, your doctor might detect a problem when they're just looking at your blood sugar level, which is what most doctors look at. But typically for about 10 years before that, your insulin level will be elevated. And unfortunately, a lot of doctors don't check an insulin level. So one very simple thing you can do is ask your doctor to check an insulin level. Get it checked when you're fasted. And if that number is above 10, it's a pretty good indicator that you're insulin resistant. This process has already started. And the problem is that process then has a lot of downstream effects, which include, the development of fatty liver disease, the development of atherosclerosis, plaque in your arteries, inflammation throughout our bodies, including in our brains, that can lead to things like, depression, anxiety, Alzheimer's disease, as it advances. It can lead to many forms of cancer. So this is why metabolic health and insulin resistance is so important to assess and to measure. And so, again, ask your doctor for a fasting insulin level. If your doctor says, I can't order that for you, it's too expensive, I don't know how to do that. There are many websites, one that I love, and I don't have any relationship to them directly, except that I like what they do, ownyourlabs.com, OWN, yourlabs.com. For $8, you can order your own insulin level. You pay for it on the site, you take the slip to your local LabCorp center, they'll draw the blood, they'll run the blood, and you'll know what your insulin level is. So, that's a great resource. Again, one of the things we may be able to incorporate into the program that we do for the department is going to be some at-home testing. We have an option. We have kits that allow you to test your blood at home, do a lot of the metabolic health testing. If you go to my book, if you go to our website, we also have some resources on what testing you should be asking for, what testing you should be getting. And another example of empowerment. And if you take your list of tests to your doctor and they say, I can't do that, maybe find another doctor, go order it for yourself, go find other practitioners that are going to be able to support you in this important journey.
Okay, thanks. So avoiding sugars, right, which would cause the release of insulin in your body, is the goal through diet, right? So a couple of things, like, how does your body process sugar versus carbohydrates, and is there a difference in terms of insulin response to either of those foods? And on top of that, does it matter what kind of sweetener we're talking about in terms of an insulin response? Because a lot of people will think, well, I'm going to have honey, so this is okay, or I'm going to have raw sugar, it's not granulated sugar. Does your body really care what you're putting in it in terms of an insulin response?
Yeah, great question as well. So, once you're insulin resistant, the priority really becomes, bringing less sugar into the system, bringing less glucose into your bloodstream. And understand that your body processes carbohydrates, no matter what their source is. It can be a piece of fruit, or it can be, a candy bar. And, if they have the same kind of grams of sugar in them, they're going to have the same effect in your body. Your body really doesn't differentiate between, carbohydrates, different sources of the carbohydrates. There are some other factors that go into it. For instance, if you're drinking a soda with, 50 grams of sugar in it, that's basically mainlining it because your body absorbs that very quickly. If you're eating a piece of fruit with 50 grams of sugar in it, there's some fiber in it, it's going to kind of slow down the absorption. And so, there may be a little bit of an advantage there. But ultimately, sugar is sugar. And our liver really doesn't differentiate. Our bodies really don't differentiate. Now, the sugar substitutes, the non-sugar sweeteners, are a different story. Yes, they don't bring sugar into the system. They may not elevate your blood sugar in the same way, but they oftentimes cause an insulin response, and they can actually cause you to become more hungry because your mouth, your brain says, it tastes it and says, oh, there's sugar coming into the system. We better make some insulin to get ready for this sugar. Your insulin level will go up. Sugar doesn't come in, so your blood sugar now drops, and this can make you more hungry, which can be a problem. So, there are some cautions around the sugar substitutes as well. But high level concept, what I want, guys to get out of this today, what I want all of you to get out of this today is, if you're insulin resistant, you got to bring less carbohydrate, less sugar into the system. If once you've corrected your insulin resistance, there may be some latitude there. If you're more active, you have more muscle mass, you may be able to tolerate carbohydrates without some of the ill effects. But the other part of this to understand is your body does not need carbohydrates. There is zero necessity for carbohydrates in the human diet. Your body will run just fine without them. So, they're not a necessity. And then you have to start asking yourself, okay, what benefits might I be getting from eating these foods as you start to think about your food options?
Perfect. Thank you. So shifting gears a little bit, going back to, being a fire bureau, we spend a third of our lives at the firehouse. We do all of our own cooking there. I know you talked about the quality of LDL versus quantity in terms of the use of processed cooking oils. So like vegetable oil, canola oil, grapeseed oil, in cooking, and how does that play a role in heart disease?
Yeah. So, when we look at our food environment, it is clear that processed food in general is ruining our health, and specifically our metabolic health. The processed food that we eat has two particularly problematic components to it. One is the highly refined carbohydrates and all the sugar. And the other is vegetable and seed oils, which, again, our bodies didn't evolve eating these things. For millions of years of our existence as human beings, these things didn't exist. And so, we didn't evolve the mechanisms to deal with them. So, you'll look at the bottle of vegetable oil, of canola oil, and it's going to have the American Heart Association stamp of approval on it to say that it's heart healthy. And the reason it has that stamp of approval on it is because, for the most part, consuming these oils will lower your LDL cholesterol level. The problem is that they make the quality of your LDL cholesterol worse. And so therefore, I honestly don't think they're any benefit to our heart health. And I really put them in the category of harmful to our heart health. My overarching philosophy when it comes to what we eat is we should be eating the whole real food that we have been eating for, our entire existence as human beings. We should be eating, what our grandparents, great grandparents were eating. The modern food environment that has been introduced over the past 150 years has clearly worsened our health. And so, the simplest answer to that to me is let's go back to what we were doing before. And so, I don't, I know that red meat is not harmful to your health in any way. And I say that as a heart surgeon with a focus on heart disease, but all the other, negative things that have been associated with eating red meat, increased risk of cancer, heart disease are probably the biggest ones. This concept that it's going to, make you too acidic is another one I hear a lot. They're just not true. Very lousy science. Some of it probably intentionally fraudulent. Other just, poorly done associational stuff. Red meat is not harmful for your health. And again, I believe that there's no reason we shouldn't be eating it in abundant quantities and, avoid the processed food, eat whole real food. And that applies to the oils as well. So when you're thinking about cooking, I encourage people to think about animal-based fats. So these are going to be things like butter, lard, tallow, ghee, and then fruit oils. So these are different than seed oils. They come from the actual fruit. This is going to be your olive oil, your coconut oil, your avocado oil are the most common ones. With olive oil, you have to be careful. You have to make sure it's good quality because a lot of the olive oil manufacturers here in the US will cut it with vegetable and seed oils because that increases their profit margin. And so you got to make sure you're actually getting real high quality olive oil. But really my go-tos for cooking are, butter and then either lard or tallow. The honest truth is when you're eating whole real food, you really don't need all that much of that. You're going to take your steak or your burger, you don't need to add any extra fat to cook that. You want to saute up some vegetables, great, do it in butter for the most part. And I think that's a good approach.
Thank you, Dr. Ovadia. So I'm going to wrap things up just a little bit. So I've already received a few questions as kind of what's next and how can our members work with you? And this is something that we've discussed initially. So this is just going out to everyone what our plan is and what my job is to provide information to you. And then if you're interested to go further, like with an expert like Dr. Ovadia, that would be something we can help provide you access. And what we're looking at is setting up maybe a group that is interested in working further for consultation. But that would be something you're paying for personally, and they can work with you on insurance coverage and so forth. So if there's anyone with any questions further on that or anything else, go ahead and ask in, or you can comment in the group. And then what I'd like you to do from here is email me to my work email, Jessica, and I'll put it in the comments, .cone, like the ice cream cone, at portlandoregon.gov. And then anyone that reaches out, we will follow up with you on what you can do to move further.
Yeah, I think that sounds good. And what we'll do on our end, Jessica, is probably provide maybe just a link, a simple web form that people can fill out as well to express interest. What we're envisioning is sort of a group coaching program specific for the members of the department, and then we'll also see what kind of interest there might be on maybe one-on-one coaching, which we have available, as well as I do have a private telemedicine practice that I work with people across the country. I am licensed in Oregon, so telemedicine with me is an option as well. And that's one of the things that my team can discuss with people.
And Brian Keith, who's on Dr. Ovadia's team, posted a link in the comments for more information. And as I said, just go ahead and email me, and then we'll develop a group and connect you with Dr. Ovadia and his team. And then Tyson, do you have anything else to add from there?
No, I think this was great. Thanks for your time, doctor. And if anybody has any other questions, they can get a hold of Jessica or myself for follow-up. Yeah.
Yeah, thank you.
Thank you so much. And Tyson's just handling this as a point of contact for me. As everybody knows, or hopefully knows, we're rolling into our fitness assessment. So I'll be doing that for the next few months. So if you have any questions as well, you can contact Tyson. So Tyson, I don't know if you want to quickly, you could put your email in the comments as well. But it was on the flyer of the information we sent out, or just message me. I can connect you. Thank you, Dr. Ovadia, so much. And we'll follow up with you soon.